South End is very different from other compound pharmacies because we have one thing that a lot of companies don't. We focus our entire model on you. Everything we do here, this new facility that we put into play, is all related to being able to get you the care that you need faster. I don't think anybody out there can do it as good as we do. When providers reach out to us with any question, they're clinical or not, our team of pharmacists are here to help them. And we listen. They're able to pick up the phone, call us. Humans, at the end of the day, are able to pick up and talk to them. I see South End headed to be the leading compound pharmacy in all of America.
Hi there, thank you for joining us today. I'm Haley Calavo, and I'm the Vice President of Marketing here at South End. Thank you for your attention to that video. We're super excited to feature our new Houston-based facility. We are a 503A Houston-based compound pharmacy for those of you who aren't familiar with us. And we are expanding our reach across 35 plus states and have served over 10K providers to date. Very excited for all the education we have in store today. And I guess I kind of sit in this marketing seat over here where, the compounding professional in me loves to see this application of education for providers and just how what we do every day as compounders and how it's translated into clinical application. So I'm super honored to be here today. Looking forward to what we have in store. I'll just start with some of the nuances of disclaimers and Q&A and just make sure everybody's ready for this really fantastic presentation we have planned. First off, our disclaimers. Today's information is just for educational purposes only and does not constitute legal advice. Attendance or receipt of these materials does not actually make an attorney direct relationship. And please, consult with your own attorney for legal advice, before using any of this in your best practice application. Also, compounded medications obviously are not FDA approved for safety, effectiveness, or quality. And, just take that with a grain of salt, and we'll be really excited to share just a little bit more about South End on our next slide. But first, just as a little housekeeping item, if you'll look down at your three little dots that say more, if not showing on your screen at the bottom, we will also accept your questions during the webinar. We want to make sure they're captured at the end and that you get everything you came today to go back to practice and be able to apply this information today. Next, I just wanted to dive into what makes South End so great, just for a few minutes. We really have set this standard, and so we kind of coined this the South End standard. Why? There's these four pillars that I feel like really button up underneath this that as our unwavering commitment to what providers and patients deserve. So it's kind of this intersection where compliance, clinical expertise, quality, and speed all come together to make this partnership that's really mutually beneficial for your practice. Next, I would love to kind of highlight all the work our team has been head down doing, our commitment to providing innovative formulas and bringing an expansion of our product lines. In the past, we've just been like a metabolic health or support type of compound pharmacy. Excited to announce that we've been expanding our product lines in Q2. If you haven't had an opportunity to speak with your account manager or have more questions following this, we'll make sure we can get you in touch with the right team to have these conversations. But what I would like to say is that most recently we released Glutathione and extended BUD testing on NAD plus, and also Somorelin. So we're excited that the medications that you see on the screen right now have a 90-day BUD from date of compounding. We also are released MIC and methylcobalamin to extend our metabolic support line. So really excited to be able to have more products and more tools in your toolbox as you see patients. Next, next, I would love to introduce our speaker, Dr. Pamela Smith. It is quite an honor to have her today. Dr. Pamela Smith actually spent her first 20 years of practice as an emergency room physician at a level one trauma center in Detroit, and then pivoted to functional personalized medicine for the last 29 years. She is an internationally known speaker, holds a master's degree in public health along with a degree in metabolic and nutritional medicine. She also practiced in private practice in medicine at the Center for Personalized Medicine in Michigan and Florida. And she has been featured on CNN, PBS. She has written over 16 books and is a co-director of the Personalized Medicine certification at the Morsani College Medicine, University of South Florida. And wow, we are just incredibly excited to have you, Dr. Smith. Always gives a fantastic presentation, keeps me thinking, looking, searching for your next book. So welcome. We're so excited to have you.
Thank you very much. I am thrilled to be here. Today, we're going to take a bird's eye view on stress and mitochondrial function because literally that is the objectives or are the objectives is basically stress affects everything, but the engines of the body, the mitochondria, is probably the most important thing that it can positively or negatively affect. There's lots of references on the slides. Some of them are in my book, What You Must Know About Women's Hormones, as well. So when we look at the idea of stress, it's based on the type, timing, and severity of the stimulus itself. So it can be either a triggering or aggravating factor for many diseases. In fact, probably every disease that you can think of. One underappreciated potential mechanism that stress has on the body is related to the effects of both the psychological and environmental stress on micronutrient concentrations. So micronutrients are things like zinc, calcium, iron, niacin, and other nutrients that are really, really important. Long-term stress causes inflammation, which is the root of all disease. Almost any disease after the age of 42 is inflammatory in nature. A little bit of inflammation heals, too much causes disease. So inflammation is related to a compromised immune system and the development of worsening of almost everything you can think of, whether it's cognitive decline, heart disease, Hashimoto's, etc. The emerging medical literature suggests that stress has a role in the etiology of type 2 diabetes. It's not just the genes that you inherited. And perceived stress in this study was a strong risk factor for type 2 diabetes. This study from 2017 suggests that 75 to 90% of human diseases are related to stress. And the authors of this article discuss the role of inflammation in stress-induced diseases and suggest a common pathway for stress-related disorders that's based on chronic mild inflammation. Studies have shown that stress can activate an inflammatory response in the brain as well as peripherally. And the most common stress-related diseases are cardiovascular diseases, metabolic disorders, psychotic and neurodegenerative disorders, and cancer. Pretty much what all of us deal with every single day. Stress in early life impacts what happens later in life. Chronic low-grade inflammatory load shows the link between stress and heart disease. So inflammatory markers like interleukin 6 and C-reactive protein do climb. This animal study found that insulin resistance develops during acute or chronic stress, so it can be either one. There is a relationship between stress, inflammation, and another disease that we see a lot of, depression. 4-week chronic stress exposure significantly upregulated all these inflammatory markers, TNF alpha, interleukin 18, interleukin 1 beta, and inflammatory induced nitric oxide synthase expression. So when it comes to stress and inflammation, very much related to neurodegenerative disorders like Alzheimer's and Parkinson's disease. Chronic stress is demonstrated to also be related to several forms of cancer and not just the development of cancer, because we all get cancer cells. If we have a normal immune system, a healthy immune system, it is killed off. 3 things feed cancer cells: stress, sugar, and toxins. And chronic stress is thought to correlate with the etiology of tumor growth, progression, and metastases. Chronic stress signal the beta adrenergic activation, the main cause of pancreatic cancer, leukemia, breast cancer progression, and invasion. Very interesting studies. When I was in medical school, 1 in 24 women got breast cancer. It's now 1 in 8, and a new study coming out shortly will show 1 in 7. It doesn't have to be that way. Looking at the idea of stress, inflammation, mitochondrial function will help all of this. Chronic stress can also cause corresponding changes in the body's immune function and inflammatory response. And some of this is predicated on all hormones in the HPA axis. It is not just cortisol itself, but do not forget that estrogen, progesterone, testosterone, DHEA, cortisol, pregnenolone, melatonin, all of these are anti-inflammatory in nature. So looking at cortisol, the release of cortisol is under the control of the HPA axis. CRH is released by the paraventricular nucleus of the hypothalamus. It then acts on the anterior pituitary to release ACTH, which then acts on the adrenal cortex. And corticotropin receptors are present everywhere in the body, from the nervous system, immune system, cardiovascular, respiratory, reproductive, musculoskeletal, and even the skin. So every patient you can think of, male or female, whether they're 2 years old, 20, 40, 80, or 100, their different symptoms are very much related to cortisol itself. And that does include the engines of the body, the mitochondria. They are commonly known as powerhouses of the cell due to their ability to perform oxidative phosphorylation, a process that generates energy. The process of mitochondrial DNA transcription, translation, and replication operate autonomously without being influenced by the actions of nuclear DNA. In other words, the mitochondria has its own DNA, the mitochondrial DNA. So an individual's mitochondria are inherited 100% from their mother. The mitochondrial matrix contains enzymes of the Krebs cycle and beta oxidation pathways that metabolize ingested energy food substrates, including sugars and fats. Mitochondria also have a single nucleotide polymorphisms that correlate with the patient's ethnicity. The mitochondrial DNA does not have loose ends, and therefore it does not contain telomeres. So very different than the other DNA produced in our body. It lacks introns and are more susceptible to damage. So the mitochondria is very, very sensitive in the body. What are the functions of the mitochondria? It helps make ATP. It regulates central metabolism by controlling the breakdown of nutrients, facilitates apoptosis or programmed cell death to help maintain a healthy tissue balance. It stores calcium ions, which regulates cellular calcium levels. It generates ROS. It participates in the synthesis of some of the hormones and metabolites in the body. So mitochondrial function is important in all of these areas. It's important in everything we do in our practices and everything the pharmacy does, from longevity to athletic performance, adaptation to high altitude, which I was just at yesterday, up to 4,000 feet. Even though I'll be 72 in a couple of days, I adapted very well to that change in altitude because I was only there for a day. Diabetes, neurodegenerative disorders, psychiatric disorders, even macular degeneration has to do with mitochondrial function, AIDS progression, and whether it progresses or not, cancer, and obesity. This is a great trial. If you've not looked at this study, you should. So how do the mitochondria work? It really is very complex. I put some of this here for you. Everybody will get a copy from the pharmacy today of my seminar, and animal studies have revealed that the mitochondria directly influences the metabolic regulation, brain function, immune activation, and what happens with longevity in the body. In fact, the effect of thyroid hormone on the mitochondria is key because the thyroid regulates everything that occurs in the body. So energy and growth regulations of thyroid have a profound effect on the mitochondrial inner membrane protein, lipid compositions, ATP production by regulating oxidative phosphorylation. And oxidative phosphorylation is the process by which the respiratory chain, a group of protein complexes located in the inner mitochondrial membrane, is responsible for generating the majority of ATP produced by the body. So when it comes to longevity, essential for maintaining the balance of the mitochondria comprises mitochondrial dynamics, autophagy, and biogenesis. So mitochondrial dynamics refers to the continuous process of division and fusion that occurs within the mitochondria. And the integrity of the mitochondria can change with age and commonly does. Abnormal mitochondrial dynamics can also expedite cellular senescence. In fact, our immune system is not designed to have immunosenescence. It does not have to if the patient's hormones are balanced. And that includes all the hormones, including cortisol. So to maintain mitochondrial health and delay the aging process, it is crucial to maintain a state of equilibrium between mitochondrial fission and fusion. So you have mitophagy, where cells removed damaged mitochondria from the system. This completes the process of liposomal degradation, and it's crucial for the regulation of the quality of the mitochondria. You have biogenesis. Mitochondrial biogenesis is a cellular process that's responsible for maintaining a consistent number of the mitochondria by replacing damaged or aged mitochondria with new ones. And the genes in both nuclear DNA and mitochondrial DNA work together to govern the process of mitochondrial biogenesis. These factors stimulate biogenesis, increase energy demands, physical exercise. I don't know about you all, but I personally hate exercising, but it is one of the most key things that you can do in the body. Other factors that stimulate biogenesis are exposure to cold and certain cellular stressors. So mitochondrial illnesses, there's two types, primary and secondary. And I put a picture of the mitochondria right there for you. Primary are inherited mitochondrial dysfunctions. So the diseases you think about, the coexistence of mutant and wild type mitochondrial DNA, referred to as a heterogeneity, accumulates during aging and is associated with worsened clinical performance. In fact, there's a growing list of over 300 monogenetic autosomal defects at the origin of every broader range of clinical complex diseases. They pushed mitochondria and its dysfunction into the area of other medical specialties now, of endocrinology, oncology, cardiology, immunology, GI health, and other fields of medicine. Genetic and biochemical mitochondrial defects cause debilitating multi-systemic clinical disorders. And that's what I love about the kind of medicine that we do. And that's what I love about a personalized medicine approach to pharmacy, is that it looks at the cause of the problem and not just treats symptoms. So mitochondrial health is paramount for the patient to have, well, let's put it this way, to live to be 100, not just 100, but a healthy 100 years of age. Secondary mitochondrial illnesses arise from external forces. Common causes are metabolic disorders like diabetes. Toxins are playing a bigger role now because of BPAs, microplastics, nanoplastics, phthalates, toxic metals. When we say toxins, we mean forever chemicals. We also mean what looks at in the body related to mold, long-term stress, and chronic disease. Secondary mitochondrial dysfunction also causes illnesses like heart failure, neurodegeneration, and metabolic syndrome. Abnormal dynamics and quality control, dysfunctional proteostasis, inherited ATP production, calcium dysregulation. All of these things affect the capacity of what happens with the mitochondria. So therefore, it's not surprising the mitochondrial dysfunction is frequently implicated in the pathophysiology of almost every single disease you can think of and the aging process, because longevity medicine now is very much taking the forefront. And what we used to call functional medicine is now longevity and a personalized medicine approach. Excessive exposure to reactive oxygen species leads to oxidative stress. This results in protein oxidation and mutations in the mitochondrial DNA. So continuous decrease in ATP leads to abnormal energy consumption. This impedes the process of the autophagy in the mitochondria. It decreases the production of new mitochondria, and it impacts mitochondrial dynamics. So these abnormal changes ultimately lead to cellular senescence and to death. And this is a great study from 2024. Reduced mitochondrial dynamics and function play a crucial role in major diseases like Alzheimer's and Parkinson's. Again, a study from 2024. When it comes to Alzheimer's, and to me, it's all about vision, memory, and mobility. So Alzheimer's is a scary disease process for most people, but improving and sustaining the energy production of the mitochondria decreases oxidative stress, it boosts mitochondrial activity, can all contribute to decreasing the risk of developing Alzheimer's disease. When it comes to Parkinson's, it can arise from many reasons, like exposures to environmental toxins, mutations and deletions in mitochondrial DNA, abnormal expression of genes associated with Parkinson's disease, and genetic mutations. So Parkinson's disease, as we all know, is characterized by the depletion of dopamine in the substantia nigra, but this is related to the production of reactive oxygen species. Abnormal expression of mitochondrial complex 1 leads to a decrease in ATP synthesis. So oxidative stress ultimately causes the death of dopamine neurons in the substantia nigra. And then, of course, a very common disease process, heart disease, mitochondrial dysfunction, has been significantly associated with the development of various cardiovascular diseases, from cardiomyopathy to ischemic damage and even heart failure. Type 2 diabetes, the disease process that causes the entire world the most when it comes to healthcare dollars, is type 2 diabetes. And emerging evidence supports a potentially unifying hypothesis that both prominent features of type 2 diabetes are caused by mitochondrial dysfunction. Within the context of type 2 diabetes, various organs in the body exhibit structural, functional, and molecular changes in mitochondrial function, such as mitochondrial dysfunction in the digestive system, and the gut health, as we all know, is really important, musculoskeletal system, and cardiovascular system. And again, another study from 2024. Cortisol imbalance, very much related to insulin resistance and diabetes type 2. One of the key components of cortisol dysfunction is abnormal blood sugar and insulin levels, but this is related to the HPA axis. Higher secretion of glucocorticoids influences glucose metabolism by promoting gluconeogenesis in the liver. It suppresses glucose uptake, promoting lipolysis in the adipocytes, suppresses insulin secretion, causing insulin resistance, and, of course, inflammation. So when it comes to insulin resistance, mitochondrial dysfunction has been intricately related and linked to the development of insulin resistance. In the liver, mitochondrial dysfunction exacerbates hepatic insulin resistance and promotes the development of non-alcoholic fatty liver disease, which leads to the production of pro-inflammatory cytokines. This feature that ties all of these conditions together, the feature that ties all of these together, is their varying degrees of mitochondrial dysfunction and their relationship to the stress response. So the mitochondria has importantly been shown to be a key component of the stress response itself. We used to think, oh, let's go ahead and do a saliva test. We'll look at cortisol at 8 in the morning, 12 noon, 4 p.m., 10 or 11 p.m. at night, and it's really a lot about stress, and it is. But stress and the mitochondria go hand in hand if the things in the body are not functioning as well as they could. Studies have shown there's mitochondrial crosstalk that occurs in patients that are stressed. Newly discussed in the medical literature is that reactive oxygen species can have both a beneficial and detrimental effect on longevity, depending on the conditions. In fact, recent evidence clearly points to reactive oxygen species as powerful mediators of longevity that act as downstream effectors of mitochondrial modulation during stress. So when you look at the psychological stress and mitochondrial function, evidence supports the concept that acute and chronic stressors influence various aspects of mitochondrial biology, and that chronic stress response can lead to molecular and functional changes among the mitochondria. So now we can even test mitochondrial function or dysfunction. Fortunately, now, in the era of science, we have different companies that are able to test all of these different things. We don't have to guess at what happens with the patient. We can take science now to help us help them be healthier and even happier. The link between chronic psychosocial and metabolic stress and the pathogenesis of disease has been discussed now in the medical literature. And central to this process is the mitochondrial regulation of energy metabolism and cell signaling. So chronically elevated glucose levels damage both the mitochondria and the mitochondrial DNA, generating toxic products that can promote inflammation all over the body. It can literally alter gene expression and hasten cell aging. So if you ask me what hormone is the most important in the body, I might be hard pressed to say it's not insulin because it probably is. Elevated glucose levels do all of this damage in the body. And in the United States, 80% of people after the age of 40 already have insulin resistance or type 2 diabetes. If we focused on all of this, I think we could really look at the cause of the problem. These maladaptive mitochondrial changes that characterize this subcellular state of stress are related to mitochondrial allosteric load. And the concept of mitochondria allosteric load defines the damaging structural and functional changes the mitochondria undergo in response to high glucose levels and stress-related pathophysiology. Is when the patient's stressed, what happens to blood sugar? What happens to fasting insulin? They both go up. So psychological stress, mitochondrial function, and depression also go hand in hand. In human trials, chronic stress may induce depression by potentiating mitochondrial allosteric load. You get an elevation in the harmful reactive oxygen species. It damages the mitochondrial DNA and it increases membrane permeability and pro-apoptotic factor release. This study revealed that severe psychosocial stress induces mitochondrial dysfunction, thereby increasing the vulnerability to developing depressive symptoms. And that includes all of us. A major study came out yesterday showing that the number one reason that healthcare providers are having problems is stress. But the reason for that stress was moral issues that we all practice under a factor where we have to answer to people that maybe that response that we have is predicated by what the insurance company says and may be predicated by the politics of medicine, and that is causing the provider stress themselves. So the first place we want to look at this as looking at ourselves. So honestly, I've done my own cortisol level a zillion times. I've done my mitochondrial health test to look at this relationship among each other. There is a biodirectional link between stress, depression, and type 2 diabetes, but you probably have all figured that out by now. But a great study. Moreover, in relationship to psychological stress, mitochondria have been shown to affect the endocrine system, the immune system, and what goes on in the brain. And the psychosocial experiences and life exposures influence subcellular processes, including immune activation suppression. Stress, psychosocial experiences influence subcellular processes, including whether that patient is going to get cancer or not. And the psychosocial experiences that are stressful influence subcellular processes, including epigenetic processes as well. So the psychosocial experiences related to stress and life exposures influence subcellular processes, including telomere maintenance. So how that patient does when it comes to longevity medicine has a lot to do with how much stress they've had, starting from when they're a child throughout their entire life, and how they mitigate that stress. The psychosocial experiences and life stress exposures influence subcellular processes, including gene regulation, and the mitochondria both are a target of stress and are a mediator of stress pathophysiology. So stress affects the functions of the mitochondria. It affects the energy production, which fuels most of the reactions in the body, major producers of reactive oxygen species. However, it can lead to oxidative stress, which then overwhelms the antioxidant defense mechanism, possibly playing a key role in the neurodegenerative processes and in stress pathophysiology. The quality or function of the mitochondria also varies independently from mitochondrial content, and this may influence their responses to stress. Tissues with different metabolic demands contain different types of mitochondria, defined either by their function or by their protein composition. So the neurons are different than the relationship to the mitochondria. They're different from the mitochondria in the cell body themselves. Therefore, examining both mitochondrial function and content plays a broader role in looking at mitochondrial recalcification and what happens with the calibrations. Stress exposure may also independently influence mitochondrial content and function. So this study used the mouse model to show this. So major themes, and then we're going to look at what we do on Monday morning. Major theme, chronic stress induced through a form of psychosocial stressor decreases mitochondrial energy production capacity and alters mitochondrial morphology. So it changes the actual structure. Theme two, acute and chronic stressors are different and some different changing cases of opposing effects on mitochondrial functions. So acute stress can damage the mitochondrial structure within hours and enhance certain aspects of their function. And several studies investigating mitochondrial morphology and the ultrastructure by electron microscopy reported acute mitochondrial damage with stress. Increased size of the mitochondria occurred with chronic stress, and different effects on mitochondrial DNA. Copy number have also been reported. One study found that 50 to 60% decreased mitochondrial DNA copy number in various brain regions after chronic, unpredictable stress. So another study here showed the exact same thing, where the liver had the highest amount of change. Antioxidant enzymes may also be upregulated acutely, likely as an adaptive response, but then decrease with chronic restraint stress. Number three, because parts of the respiratory chain are encoded by the mitochondria DNA and other components are not comparing them allows one to differentiate between functional changes that arise from the mitochondrial DNA and those that arise from other mitochondrial mechanisms. The respiratory chain complexes, like complex 4, otherwise known as COX, is encoded by the mitochondrial DNA, which was the most frequently affected. So when you look at theme number 4, certain factors can influence mitochondrial vulnerability to stress with genetic factors. They can sensitize or confer a predisposition of mitochondria to the effects of psychological stress. So the mitochondrial stress and metabolomics have a direct relationship as well. One study revealed circulating metabolic profiles in response to induced stress that are suggestive of altered energy metabolism, implicating mitochondrial respiratory change dysfunction. That also affects the proteomics of the body as well. So the mitochondrial proteome differs between the mouse model of low versus high anxiety disorders. You can end up with changes in transcriptomics as well in the body. In human studies, stress does have these same effects on the body, including adverse childhood experiences that occur. In this study, measured microbial or mitochondrial respiration and cellular mitochondrial content in the frozen leukocytes of women reported significant changes due to what happened to them in childhood. And this leads to inflammation. Again, inflammation is where it's all about. Mitochondrial changes do occur, and the immune system's response to stress or infection can be initiated by the release of the mitochondria DNA. Inflammation can be triggered by mitochondrial dysfunction and the subsequent release of mitochondrial components. Both good and bad emotional experiences are suspected to trigger broad-acting biochemical pathways, such as inflammation, meaningfully influence morbidity and mortality. There's some interesting studies actually on AFib, and part of this is related why more commonly we're seeing AFib now than we ever used to be. So stress, in summary, looks at mitochondrial dysfunction. Cortisol is a stress hormone that influences mitochondrial function. The mitochondria are critical for energy production and cellular metabolism, and stress can lead to mitochondrial dysfunction, which can negatively impact energy levels in the body. Chronic stress can lead to increased production of ROS, which leads to oxidative stress. The mitochondria plays a crucial role in energy production, which can be affected by cortisol. And chronic stress and high cortisol can impair cellular metabolism and energy balance. Research does suggest that managing stress may improve mitochondrial health and function. Oxidative stress from environmental, like toxins, or psychological stress can damage mitochondrial DNA. Exercise and antioxidants supports mitochondrial function when the patient is under stress, and antioxidants can help mitigate the negative effects of cortisol on the mitochondria. So what are we really going to do on Monday morning? We want to have nutritional support. So I'm going to talk about a mitochondrial cocktail. Exercise is key to enhance mitochondrial biogenesis. Dietary interventions. People always ask me, what kind of diet should I eat? My answer is always the same for everybody. The Mediterranean diet, which is rich in antioxidants, healthy fats, and it decreases inflammation. Avoiding toxins, minimizing exposure to environmental toxins that it can impair mitochondrial health. And managing stress is key. Hormonal balance, it does matter if that patient's on bioidentical hormones. They want to live to be a healthy 100 years of age, and they, of course, should be compounded and made individual for that particular patient. Pharmacological agents, there isn't one known anti-aging drug like metformin. Also, rapamycin for potential effects positively on the gut. Gene therapy is now leading the way, trying to correct mitochondrial DNA defects. Cold exposure can be helpful. And then in the forefront in medicine soon will be mitochondrial transplantation. So antioxidants and other compounds can provide protection against stress-induced mitochondrial dysfunction. This is my personal favorite mitochondrial cocktail. It does look at the things we need to refuel the mitochondria. Coenzyme Q10 and alpha-lipoic acid at 300 to 400 milligrams a day. L-carnitine, 1 to 2,000 milligrams a day with normal renal function. You do have to measure TMAO first, which is a blood study done at any major lab, fasting. The TMAO has to be normal to give L-carnitine or to give choline for that matter. Only 2 reasons for abnormal TMAO. You inherit a gene for it or the gut is not healthy. Obviously, if the gut's not healthy, you fix the gut. If you inherit a gene, which is 1% of the world's population, then the patient cannot take L-carnitine. They cannot have L-choline. They should not eat red meat, egg yolks, or drink milk. Magnesium glycinate is so important. 400 to 600 milligrams a day, may even need more than that because magnesium is important, a cofactor for 300 reactions in the body. You could use magnesium threonate as well, D-ribose, 15 grams to 30 grams, and then NAD plus, very, very important as part of this mitochondrial cocktail. NAD is the essential metabolic nutrient involved in multiple reactions that regulate cellular metabolism, energy production, DNA repair. It helps the autophagy, mitophagy, inflammation, and neuronal function. NAD plus levels decline with age. They also decline with major disease processes like heart disease, diabetes, cognitive decline. And a reduction in NAD plus affects all the hallmarks of aging. So there is a great study there. The biosynthesis of NAD plus includes four major pathways, which you're all aware of, but I put here for completeness. During aging, the level of NAD plus declines, and proteins involved in the biosynthesis and consumption of NAD plus are altered. Depletion of NAD plus has been linked to age and disease-related telomere shortening and dysfunction, and NAD plus reduction is seen in the major disease processes of aging. Fortunately, we are now able to give patients NAD to help them prevent and treat major diseases. This study suggests that NAD supplementation has great future potential clinically, and the studies more and more are going to be looking at what happens in the aging process. Other mitochondrial nutrients that are important are NAC and acetylcysteine. It should be taken with vitamin C to help prevent an increase in kidney stone formation. It does deplete the body of zinc and copper, so the patient should also be on a multivitamin. NAC increases glutathione levels in the body. The patient should not have NAC if they're on nitroglycerin because it can cause hypotension. And then, of course, my personal favorite, glutathione. This is a tripeptide composed of amino acids, cysteine, glutamic acid, and glycine. It's the strongest antioxidant produced by the body. It is found in every single cell. It's such a great antioxidant. It gets rid of the damage caused by oxidation and free radical production. And after the age of 40, or anybody at any age that has a major disease process that relates to the mitochondria, glutathione levels commonly begin to diminish. So mitochondrial health very much related to glutathione. But don't forget about how this all happens. It has to do with methylation. If you look at the methylation pathway, all of it, the importance of methylated vitamins like B12, B6, looking at all B9, methylation. Remember that methylation pathway goes into transsulfuration, and on one side of that pathway is glutathione, and the other side is the ability to detoxify in the body. This is something we can measure as well in the body, looking at a mitochondrial health test. Functions of glutathione, it is a neuromodulator, acts as a neurotransmitter, decreases sugar cravings, displaces glutamate from its binding site, enhances liver and brain detoxification of toxic chemicals and heavy metals. Toxicology is becoming probably the major thing we're going to be talking about for the next 10 years. It helps facilitate cellular magnesium and glucose uptake. It helps to recycle other antioxidants like vitamin C and E. It's a powerful antioxidant. It's part of the amino acid transport system in the body. Glutathione plays a role in protein and prostaglandin synthesis. It stimulates the production of interleukin 1 and 2, which helps regulate the immune system and is used in DNA synthesis and repair. I know when I personally got COVID, and it had been 50 years since I'd had a virus. Having been an ER doctor, I'm just near so many people that are sick. I don't tend to get viruses. I went to our office and had IV glutathione, and it was like somebody flipped a light switch. I felt so much better. The symptoms of glutathione deficiency are asthma, compromised immune system, depression, dizziness, faster progression of HIV, and fatigue. Please don't forget depression and anxiety in all of this. Other symptoms, headaches, hemolytic anemia, joint pain, reduced focus and memory, sleep disturbances, and these are causes of glutathione deficiency, long-term acetaminophen use, the aging process, cadmium, arsenic, lead, mercury, iron, copper, and cobalt toxicity, cigarette smoking, excessive intake of alcohol, processed chemically laden foods, and poor dietary intake of foods that increase glutathione levels. So what are those foods? I put them here for you. There's our friend broccoli and avocados and these great foods. They do increase glutathione, but for most people that have a disease process or you're trying to forget it or to really prevent it, just eating the foods is probably not going to be enough. These are other food sources as well, but certainly we want people to begin the process by eating their way into it, more foods that increase glutathione, and conditions that can benefit from glutathione supplementation. These are ones that are discussed in the medical literature: aging, allergic rhinitis, ALS, anxiety, autism, cardiovascular disease, chronic fatigue syndrome, chronic otitis media, chronic stress, as we talked about today, cirrhosis, COPD, ARDS, COVID long haul, diabetes and insulin resistance, and hepatitis C. In fact, if you think about stress and you do all the things that we have been taught to make cortisol normal, sometimes it's not. Even we do adaptogenic herbs, stress reduction techniques, etc. Do not forget about glutathione as that possible missing component. It also helps with HIV, hypertension, Meniere's disease, MS, Parkinson's, toxic metal exposure, ulcerative colitis. In other words, any mitochondrial illness would benefit from the supplementation of glutathione. And then just so you know, glutathione is counterindicated in people with sulfite sensitivity since it's converted in part to sulfite in the body. Avoiding medications such as valproate that can exacerbate mitochondrial dysfunction may also be helpful in people with mitochondrial illnesses. That's not always possible, but keep that in mind. And then really heralding in the new day will be mitochondrial transplantation. Stress reduction techniques are key to helping these patients. Prayer, meditation, Tai Chi, yoga, Qigong, exercise, massage, breathing techniques. All of these are key, as are these nutrients that we use to treat the cortisol, whether it's too high or too low. If DHEA levels are low, then we replace DHEA as well. The patient is a candidate for replacement, adaptogenic herbs, and calming herbs. When we treat hypo and hyperadrenalism, we go down the same road initially. If hypoadrenalism is not better in 9 months, then take the patient off of adaptogenic herbs and give adrenal extracts instead. You may need to give the herb licorice. Do not give it to people with hypertension. They develop hypertension on it, then take them off. The last resort is Cortef. Honestly, I haven't had to do that in a long time. Cortisol, the gold standard, is measured by salivary testing. That is what the medical and pharmacy boards now require. And all the studies now that are on cortisol are by salivary testing. So in conclusion, and then we'll open it up to questions, long-term stress can lead to increased oxidative stress, which leads to mitochondrial dysfunction. Interventions targeting mitochondrial health are really where it's going to be because it helps adrenal imbalance. Mitochondrial dysfunction has lead to various stress-related disorders, depression, heart disease, diabetes, Alzheimer's, Parkinson's disease, just to name a few. Both adrenal imbalance and mitochondrial dysfunction can lead to inflammation. Inflammation leads to almost every disease process that you can think of. So the important triad of mitochondrial health, optimal adrenal function, and decreasing inflammation. It does matter if the patient methylates correctly and they have the right kind of B-12 and other methylated vitamins if needed. It does matter if they have NAD. It does matter if the patient has glutathione supplemented, if they are going down the wrong road with stress in the mitochondria. Thank you very much.
Wow, what an excellent presentation, Dr. Smith. Excited to say we did have some questions that came in during the presentation. I have a personal question of interest, just given what you presented. What is your favorite mitochondrial health test? I heard you mention that. And so then that kind of had my mind going. I'm like, oh, there's a way to test this.
There is. It's called Me Screen, MESCREEN. Great test of the mitochondria and whether it's healthy or not.
Excellent. And are there specific markers it tests for?
There are, and anybody who wants to know how to read the test, I'm happy to show you. My email, in case you need it, is faafm63 at yahoo.com. So FAA63 at yahoo.com. And of course, everybody at the pharmacy is always willing to help you as well.
Yes, thank you so much. Awesome. Okay, well, we'll get to our attendee questions because I know they've been hanging tight with us. So much fantastic information shared. Our first question, is there any truth to concerns that CD38 blockers may be needed prior to or while treating NAD plus?
There may be, I think the science is not there to show that yet. So there may be.
Okay. Next question. Do you recommend the precursor NMN for NAD replenishing?
Not usually. If the patient needs NAD, I usually go directly there.
Okay, and then the next question may be a little bit more controversial, but glutathione, and I know you just wrote a book on cancer, so I do know you sit in this area of expertise. Thoughts and opinions on giving it to existing patients with cancer?
I do. And you know what? I really believe in traditional medicine. I do. All my patients and myself, if I ever had cancer, I believe in traditional medicine. And I would go down the traditional route for whatever cancer that may be. And I do with all my patients. But I think oncology, unfortunately, just leaves the patient there. After chemo, radiation, and some of the newer techniques of precision medicine and oncology, et cetera, are great. But what we don't do is then turn around and say, how do we help the patient be healthier? How do we help the patient build the immune system? How do we get rid of stress, counsel them on their diet? They kind of are left there after the treatment. And that's really what I believe is all of our role, where we can go back and help that patient prevent a reoccurrence, prevent metastases, et cetera. Is glutathione part of that role? Absolutely.
Thank you. Okay, next question. When treating with NAD plus sub-Q injections, can one dose a week in a healthy person who's wanting to support overall health sufficient? What ranges do you typically like to see?
That really depends on the patient. And a lot of it has to do with if that person has insulin resistance or not, and how far along they are on that continuum. So it may be enough, but it really is a personalized answer to that question.
A great consideration. Okay, and the next question. How do you feel about oral glutathione or NAD plus versus injectable?
Well, number one, the gut has to be healthy before you ever give somebody anything orally and expect it to work. So that would be the first question with all of the above. So a lot of times I do start with IV or sub-Q in relationship to all of these because we want to jumpstart the patient. If they have a long-term mitochondrial illness, then oral may not be enough, particularly initially. You may have to, particularly with long haul COVID, chronic Lyme, it may be years where oral is not enough. If someone's just coming in to see you and they had a mild infection, then maybe they just need it for a month. So it's quite variable. I've had patients doing IV glutathione long term, like 5 years, that have had chronic fatigue syndrome, long haul COVID, et cetera, until we had the tools where we do now to help build the immune system a little bit better. So quite variable, can be a month to 5 years.
That's a great consideration. Yes, I could see how gut health and some of those other implications could play into that. Well, if you did have the patient that has the repaired gut that can take the oral, what over-the-counter product would you recommend for glutathione, or are there any specifics?
I try not to get into products that should be pharmaceutical grade, meaning that it gets into the body and does what it's supposed to do, and that the products are ones that are free of toxins like lead, mercury, etc. There are no regulation on vitamins in the United States, and so pharmaceutical grade is the key idea as to what companies should be used.
Thank you for that. Next question. You mentioned a Mediterranean diet, and I heard fermented foods have a similar impact on mitochondrial health. What are your opinions of this? Also, which book of yours do you recommend I start reading? If I'm guessing the reference is the Mediterranean diet. I'm like, there's so many good ones, but yes, the question is Mediterranean diet and mitochondrial health opinions, and then which book would be the most beneficial to read on this?
Well, the Mediterranean diet really is for everybody, no matter what. If they have diabetes or they're the healthy person, it's not just heart disease, it is about inflammation. And so, fruits and vegetables, real live fruits and vegetables are key. And unless the person has a high TMAO, I do recommend a small amount of red meat. A Mediterranean diet would suggest lamb. Lamb, the fat in it is all omega-3 fatty acids like fish, and so it falls in that right category. Also, the leaner meats like buffalo, elk, and venison, and it is the amount, the size of your palm, thickness of a deck of cards. That is not a 28-ounce steak for anybody. And hummus, etc. People don't realize that chickpeas actually decrease blood sugar. So there's a lot of things in a Mediterranean diet that make it really, really healthy for people. But I find that a lot of people just don't even eat fruits and vegetables. They eat one vegetable a week and they think they're healthy, but I eat them all day long, every day. That's what I snack on. So it decreases inflammation. Just teaching people how to eat is important. And they have to have the right amount, a combination of carbs, proteins, and good fats like avocado. People still need to have good fats. Avocado is my personal favorite. So when I get done speaking today, I'm going to actually go eat some guacamole and put it on gluten-free toast. That's going to be my lunch along with some raspberries.
Ooh, that sounds wonderful. I may have to join you in that afterwards. Okay, I think this is our final question. How does liposomal glutathione orally versus glutathione injectable compare?
They've come, if you have a good company of oral, they're very close now. It used to be before the liposomal form, it had to be IV. Otherwise, it did not get into the system well. Now it's comparable. But if the patient's really, really sick, if they've got mitochondrial dysfunction, which is why I wanted to speak on that part today, they've got mitochondrial dysfunction. The IV glutathione or another form of beside oral would be a better approach with the mitochondrial dysfunction. It's a key component that is commonly missed in today's world. So I hope people get the idea that I still like oral, but you do have to have a healthy gut. And if people are eating sushi all the time, their gut's not healthy. It only takes one bad meal to make the gut bad again. So going through gut health is important. Also, do not forget that the patient's gut health is predicated on thyroid function. Their gut health is predicated on what happens with stress. It's not just do they have good and bad bacteria. It is all of these things tied together. It's not one or the other. So when the person asked about which of my books to read, I would probably say my book on thyroid disease is the second edition, which is the new edition. And if you don't get thyroid right, you don't get anything right.
That's a major component of overall wellness, I know, and especially as we're looking at metabolic health deeper, more and more as time goes on and we find out how they're all connected. Well, Dr. Smith, as always, it is so amazing to sit in your expertise for a little while today. We'll hope to have you back sometime soon. And thank you all for viewing today. We'll send out the recording of this hopefully by end of business day tomorrow, so you can share with your clinics, your staff, or anyone that you'd like to see from today. So thank you so much.
Thank you very much. Have a great day, everyone.